Hi, welcome. Happy New Year's, everyone, and welcome to my very first episode of my very new YouTube channel called The Dish on Aging. Before I get started with today's topic, I want to just say kudos to the millions of people out there who have put together YouTube channel videos. The reason why I just want to just throw out props to those millions of people is because one thing I have learned this weekend is it is actually a lot more complex than it looks. And everyone that's out there with YouTube channels and video postings makes it look easy. So great work, everyone. Okay, with that being said, today's topic is going to be why talk about aging. So let's start with who I am. My name is Dr. Maureen Sweeney. I am a clinical psychologist. I, I specialize in geriatric psychology, which means I provide care to seniors. I've been doing this for 15 years full time in Bensalem, Pennsylvania. And one of the reasons why I wanted to put together a YouTube channel about aging is because I talk about aging all the time. One of the most important reasons why we need to be talking about aging is because aging is often not talked about. And I think a big part of the reason why this is true is because of ageism. Ageism views getting older as a derogatory. People have the public has this perception that talking about aging will be sad, it will be boring, and it will not apply to them. Because of this not talking about aging, real and realistic and truthful information gets lost and important information goes unknown. At the same time, because of ageism, there is a lot of distorted information out there about aging. The reality is that aging is different than being younger. There are all kinds of aspects of life, biological, social, recreational, right down to health insurance, access to health care, life experiences, life stressors, and so on. And when aging is not talked about, the differences between generations goes unnoticed. When aging is not talked about, problems go unrecognized. Two examples of this is when we don't talk about the realistic differences between generations. How many of you out there, if you have grandchildren, find that your grandchildren may not understand why you do not use a smartphone? There's big differences in terms of experience with using advanced technology. When aging is not talked about, some of the problems that go unrecognized is somebody may have an older family member who is declining. They're having trouble getting through the basic tasks of self-care every day, but this is oftentimes not recognized. They'll say, my grandmother is only 64 years old. She's too young, relatively young, to start having problems with her memory. Another great reason to be talking about aging is that having information in advance about possible future challenges may promote better choices on how people can perhaps mitigate the problem. A prime example of this is all of the talking and information that AARP makes available to the public about how to plan for living on less income in retirement. The whole idea is trying to get middle-aged and even younger adults to start thinking about what it will be like when income is dramatically reduced with retirement. AARP tries to get people to think about, where will I live? How will I pay my bills? Maybe I need to start thinking about downsizing and reducing spending. Also, having information in advance sometimes can reduce the psychological distress. For example, if a eye doctor tells someone, look, your vision is good now, but maybe in 10 years it may not be good at all because of your risk factor for this eye condition. So you may not be driving in 10 years. This can give the person 10 years to start adjusting to the idea of how are they going to get through their day without driving. By the way, loss of driving privileges can be one of the most distressing experiences that a senior will go through. And also, of course, having information in advance about aging, it allows for better planning. One of the most common is if somebody realizes they're at risk, they may have difficulty with bad knees getting up and down 2 or 3 flights of stairs, say 10 years from now because of their current medical condition. If they're thinking realistically about it, they can start to consider, gee, is where I'm living, will that work? Does it make sense for me to move to a building, for example, that has an elevator? The next question is, why even talk about aging now, this week? The first week in January 2021. And I have to tell you, I've put this YouTube channel together it partly in response to this pandemic that our whole world and our community is going through. I can tell you that this pandemic, I can see it with my own eyes, having run my own healthcare psychology business for the last 15 years, and I've been in and out. I go to all of my patients where they live. I've been in and out of long-term care facilities. I do home visits. I spend a lot of time talking with people that use the social support programs, for example, senior centers that are available in the communities. And I can tell you right now, this pandemic has caused what will be permanent changes in many areas of life related to aging. And most people are unaware of these changes. And I think most people are unaware how greatly this will impact our lives in the future. One of the first changes we're seeing, and it's an obvious one because the COVID-19 outbreaks were so devastating to long-term care facilities. Families are now making decisions and sacrificing so that they're in their own lives so that they can provide the care for the oldest family members in their own homes. And this is going to have a huge impact if this trend continues, and I expect that it will. Also, this pandemic has caused a disproportionate percentage of seniors to be feeling social isolation, anxiety, loneliness, depression. And this is different than other age groups. It has been very disruptive for anyone who is school age, college age, someone who has young children at home. They're trying to work from home and get the younger school age children through the online schooling. There will be specific stressors associated with each age group within our society, within our community. And the impact of this pandemic has been very specific in how it has had a negative, and in some cases a positive impact on aging seniors. How it's had a positive impact is how many seniors have learned to use the internet and video technology. And so information on how to best cope with the pandemic is needed now more than ever. The next question is, why even talk about aging on YouTube? This is a novel concept for a psychologist to present community information through YouTube channels, and I'm really pleased to see other psychologists are starting to do this as well. And I made the decision to help to get information, needed information about aging and coping and stress out into the community through YouTube, because many more people have learned how to use this video technology, myself included. In my own practice since March of 2020, I've been providing all of the healthcare psychology services through the Zoom video technology. So I have developed a comfort level with using video in internet technology, and I've also developed the skills. And I think that there is still a percentage, and there are going to be many seniors out there who do not have access or ease, that they're not able to use the internet or video technology easily, but many more people are learning how to. And also, it's not like I can give a presentation at a senior center. They're all closed. And then we have to ask the question, who may benefit from these conversations about aging? And the answer is absolutely everyone. I'm targeting these informational videos to the general public, to seniors. I've talked a lot over the last few weeks and months with my patients about this program. The families of my patients, other healthcare providers, employees who work with the aged, and also I think most importantly, those elected officials and others out there who develop public policy and write new laws that will directly impact aging support systems. So, and this is also going to be helpful to anyone who wishes just to learn more real information about aging. Important information to know about the Dish on Aging. By the way, the Dish on Aging is the name of the YouTube video channel. And the most important thing to know is that all of the information that you're hearing, that you're seeing written, that is on this YouTube channel, it's presented for educational purposes only. The video content and written material, it's not clinical care, it's not clinical evaluation, treatment, or consultation. It is also important for you to know when you are watching one of these videos, if you hear something that just doesn't sound right to you or causes you distress, please just disregard what I'd said. The information may not apply to you. And also keep in mind, even if the information sounds like that it may apply to you, it may not. Also, important information to know about the Dish on Aging YouTube video channel is you'll be seeing me actually talking as part of this video cast. I will be using this PowerPoint presentation because it is helpful. I think it is a useful way to present information as clearly as I can. Um, so the expectation is that you'll see me down in a corner box, just not possible this weekend. I ran into some unexpected technical challenges in putting the two presentations together this weekend. I'll be posting a new video every week on Sunday morning. I'm posting, this one will not get up until tonight, which is Saturday night. And then tomorrow morning I will be posting the next video. If you find the video series helpful, please feel free to tell everyone about this channel. And keep in mind the video series and the slides, they're copyrighted material, but you can tell anyone about them. They can go on to YouTube to view the material directly. Also, no, I'm not being paid at all to post this information. I just think this is the type of information I share with my patients and their families day in and day out. And I decided it's time that the information just be made available to the general public as well. And so I'm using this YouTube technology to my attempt to try to get important information out to the public. So I'm not even using the series for marketing or advertising for my clinical practice. I will be following the same format with each video. I'll be starting every video where a question about aging is presented. A 2-minute answer or 2 minutes or so will be provided. And then at that point, I'll let people know if I've question's been asked, I've provided a real quick answer. If that's all the information that you need to know, then you can kind of step out of viewing the video. I have a feeling that many of you are going to want to hang in there for an additional 15 minutes or so conversation about the topic that will get into much more explanation and detail. And I think that many of you, I find my patients are most interested in and find most valuable all of the background information there, because there's just so much information out there about aging support systems in the community that's just generally not available to people, and it tends to be information that is very helpful to people and they wished that they had learned about certain programs or certain nuances about health insurance at some point earlier. So I'm sure by now you're wondering, how can you participate in an active way with this, you know, aging series, discussion series. And also you may be wondering, how can you get more information? If I've asked a question and then provided an answer one week and you want to learn something more about it or something wasn't clear to you, what you can do is you can either email me with general questions about the video. I'm also looking forward to viewers submitting questions you'd like me to possibly use for a future video. And you can also use the comment section on YouTube. Remember, anything you put in comments, it's public. Most people actually don't, they're not concerned about that at all. So I'll also be responding to the comment section of the YouTube channel page. So here's a picture of what to expect ahead each Sunday in the month of January. The first three are the first three videos of January will be directly related to the pandemic, because I think there's such a need for information right now. The first one will be, how can seniors best cope during the pandemic? Next, how are seniors being impacted by the pandemic? Next, how can family members best support seniors during the pandemic? Then where can I find a psychologist? That actually can be much more of a challenge than anyone really expects. And then what can you do if someone you love refuses to go for mental health treatment and you truly believe that they could benefit or be helped by treatment? So I'll be dedicating a video of the series to that topic. Talk to you again on Sunday, which is tomorrow. And oh yes, again, Happy New Year, everyone. Thank you very much. A beautiful soothing sight here. I took this picture in summer of 2019. I'm standing on the shore. For those who grew up with me, I grew up in a little town called Old Saybrook, Connecticut, and I was standing at Saybrook Point Inn, and we were looking out over the Connecticut River to Old Lyme, and of course Long Island Sound is to our right. So I want to share that. It's just such a nice, color blue picture photograph that will be the background of all of these slides, at least of this year. I'm hoping that this series, I have so many topics to talk about. I hope it goes once a week through 2021 and into 2022. But we'll see. We'll see. Thanks a lot. Take care.